If you have a patient with AKI, most of the time when you go for the rounds, an investigation of fractional excretion of sodium would be there. And if the fractional excretion of sodium is 2.5%, we might jump to the conclusion that it is an intrinsic renal failure. But here is the trap. If the patient is on loop diuretics, which most of the patients with AKI would have received by the time you see them, this number is completely meaningless. Because fractional excretion of sodium estimates renal sodium handling to differentiate pre-renal AKI, which has got a fractional excretion of less than 1%, from intrinsic renal, which has got an excretion of more than 2%. But loop and thiazide diuretics block tubular sodium reabsorption and artificially increase the urinary sodium excretion. So this falsely elevates FENa when kidneys are actually volume depleted also. So this is why several societies, including American Society of Nephrology, showed that a fractional excretion of sodium loses its diagnostic accuracy when the patient has received a diuretic. So this is why fractional excretion of urea becomes useful, because urea absorption occurs more proximally and is less affected by loop diuretics and other diuretics. You can have a classical threshold of fractional excretion of urea less than 35% to be pre-renal physiology and more than 50% to be intrinsic renal pathology. So in contrast, as used to AKI also, fractional excretion of sodium of less than 1% can occur despite intrinsic injury, because vasoconstriction dominates the early pathophysiology. So before ordering fractional excretion of sodium or interpreting fractional excretion of sodium in your patient with AKI, check always has the patient received diuretics in the last 24 hours. If yes, it is useless. And also check is this CKD with a low baseline GFR. In those two situations, FENa is useless and order FE urea. And also look at the urine sediments. So fractional excretion of sodium is only useful in the right clinical context when diuretics are not there in the picture. In all other situations, look for urine cast and history. Thank you.